How do catheters affect the genitourinary system? Have you ever wondered how catheters impact the genitourinary system? Catheters are medical devices that help drain urine when normal urination is not possible. They can be inserted through the urethra or directly into the bladder through the abdominal wall. While they play a crucial role in managing conditions like urinary retention and incontinence, they also have several effects on the genitourinary system that are important to understand. First, the insertion and presence of a catheter can cause mechanical irritation to the urethra and bladder lining. This irritation may lead to inflammation and discomfort. Prolonged use of catheters can increase the risk of urethral strictures, which is a narrowing of the urethra and bladder spasms. These issues can significantly affect bladder function. Another major concern with catheter use is the increased risk of urinary tract infections. Catheters provide a direct pathway for bacteria to enter the bladder, bypassing the body's natural defenses. This can lead to catheter-associated urinary tract infections, which can escalate to more serious conditions if left untreated. The longer a catheter is in place, the higher the risk of developing an infection. Additionally, bacteria can form biofilms on the catheter surface. This makes infections harder to treat and can lead to chronic inflammation. Over time, this persistent inflammation may cause changes in bladder tissue. Long-term catheterization can also weaken the bladder muscle. When the bladder is not filled and emptied naturally, it can lead to a condition known as detrusor atony. This condition impairs the bladder's ability to hold and expel urine, which may result in a reliance on catheters. There is also a potential link between long-term catheter use and an increased risk of bladder cancer. Chronic irritation and inflammation of the bladder lining can contribute to this risk, especially in individuals who have indwelling catheters for many years. However, this risk is generally low and more associated with long-term use rather than short-term use. Catheter use can also lead to minor bleeding, known as hematuria, due to trauma during insertion or removal. This bleeding is usually temporary but can be more pronounced in patients with fragile tissues. Finally, the impact of catheter use extends beyond physical effects. It can affect a person's quality of life due to discomfort, the risk of infections, and the need for ongoing medical care. To minimize complications, it is important to limit the duration of catheter use and use aseptic techniques during insertion. Intermittent catheterization is often preferred over indwelling catheters to reduce infection risk and maintain bladder function. Regular monitoring for signs of infection or bladder dysfunction is essential, especially for those with long-term catheters. Patients should also be educated on hygiene practices and signs of complications. In summary, catheters can significantly affect the genitourinary system by causing irritation, increasing infection risk, impairing bladder function, and potentially raising the risk of bladder cancer with long-term use. Understanding these effects highlights the importance of careful catheter management to protect bladder health.